Thank you for joining us for Health Home Care Coordination Workshop. Um, our mission at Person-Centered Services, we start every meeting, whether it's internally or externally, with our mission, vision, and core values. Our mission is to connect people to the care, support, and opportunities that maximize their quality of life, with a vision where a community where all people lead fulfilling lives, and our core values are people, integrity, and trust. So I am Christy Moscato. I am the Community Relations Manager in the Western 8 counties and also some Southern Tier region as well. And then my partner in crime tonight is Amy Albanese. She's our Senior Manager of Community and Provider Relations for the East and the Southern Tier. So I'm going to take the first part of the training. Amy will take the second part of the training. So this is a great visual for the coverage area. We are in 18 counties. So Person-Centered Services provides health home care coordination for more than 18,000 people with intellectual and developmental disabilities throughout those 18 counties, reaching throughout the Western New York, Finger Lakes, and Southern Tier regions. So why Person-Centered Services? So we have an incredible member relations department, and we consider the people that we serve as our members. So you will hear the next several slides. We'll talk a little bit more about member relations and the tools that are available for our members. We have a member and a provider portal to be able to access information and resources. There's a community resource tool, which is local resources and opportunities for people with intellectual and or developmental disabilities. There's a knowledge center on our website with information about IDD supports and services throughout all of New York State. And then we have a really robust emergency preparedness webpage. And with the winter months quickly approaching, there's a lot of great information on there. So even, if you're, going through the intake process, or you've recently had a loved one who's enrolled with us for health home care coordination, that emergency preparedness webpage has a lot of great information for anybody. So we're going to talk a little bit about the member portal. I'm not going to spend a lot of time on these slides, but we're going to talk a little bit about it. And the basic functionality of it is really important for the first year for all new members, because there can be secure messaging, being that we a lot of times send messages that could have protected health information, and the care coordinators are sending personalized information about your loved one. It has to be sent securely. So this is just an easier way, or the way we send it securely. It can be a little cumbersome for some people. So if you are a member, once you're enrolled, your child's enrolled, and you're able to talk to your care coordinator about requesting access to the portal, you could send messages securely through there. You can upload documents in there. You can view, download, and print life plans. And you may be saying, what's a life plan? And we'll get into that in a little bit. You can electronically sign your life plans, and you can access a lot of great information through there. You can access and print different documents and materials that are in there. At first look, there's a sign-in page. Your care coordinator will get you connected. You'll get an email from the portal, and you'll be able to create a login and password. So pretty self-explanatory there. This is what a dashboard would look like, where you could see that you might have some messages. Your child's health record would be in there. There's a documentation center, which with all the documents that your care coordinator or you have uploaded to the portal. You can send those secure messages like I was mentioning back and forth, which really makes it much easier because it's a lot. I'm not only an employee here, but my daughter is one of our members. So I love the portal for the secure messaging feature. The life plan can go in there. And again, I said, we will talk about what the life plan is, but you can even see ones that are waiting for approval or ones that have been approved and that are kind of archived. You'd be able to look at it. If you didn't save it to your own computer or to the cloud, you'd be able to access it here right through the portal. And like I mentioned, you can upload documents. A portal basically works very similar to like what your patient portal would, how it works, through your primary care physician or through any physician that you're working with. So the benefits for our members, there's, increased access to that additional information from all the service providers that are working with your loved one in a way that's better coordinated between the providers and our agency. It can help to foster stronger relationships between care coordinators and the people, offering a convenient and easy way to exchange information, ask questions, and review life plans. If you want to see what the member portal webpage looks like, you could scan that QR code and that will take you right to the member portal webpage. Now, our member relations department, we have, two staff currently on our member relations department, and they can assist members with understanding their life plan and the life planning process. Accessing resources and information, can be really important, especially my daughter has now turned 19, so she's a young adult, and I have her getting more involved into accessing all this documents because it's always been mom. Really helping to understand care coordination, their roles, responsibilities. And you can read the rest of the list. Learning about supported decision making. What is that? That's a legal alternative to guardianship. And you may be interested in that, especially as your child gets older and starts getting close to age 17 or 18. You might be thinking about that long term. And we have a certified supported decision making facilitator on our staff, and we are a certified provider for supported decision making. But generally, it's to overall improve your and your loved one's experience with care coordination. This has, I mentioned the web page. You can scan this QR code to view the web page. And we strongly recommend when you are new to enrolling, or your child or your loved one is new to enrolling into our care coordination, there's a really great care coordination orientation video on there that you can access. And then you have access to the care coordination handbook, which we recommend. I'm a person who loves to read and see everything that pertains to us. And this is a great place to access that information. So now let's talk care coordination. What is a health home? A health home is not a physical place. Believe it or not, people have thought, where is your health home located? Well, as you saw with that map earlier, we're in 18 counties and we have offices in 18 counties. So a health home is not a physical place. A primary role for a health home is to link to community supports and services, to coordinate resources, integrating that primary care with behavioral health. And the health home is the partnership between the person or member, their family, and the care coordinator. Now, a care coordinator is a person who acts as that link between the member supported and their services. So focusing on that person-centered planning. I don't think it's an accident that we're named person-centered services, because each and every service needs to be person-centered, around the member that we're serving. That health promotion, making sure that the member has everything that they need to promote a healthy life. Transitional care. Transitional care can mean a lot of things. It can be when we're transitioning, even I've always looked at as a mom, transitional care, from elementary to secondary school, then into adulthood. But it can also be if there's an inpatient hospital stay or an inpatient behavioral health stay, that transitioning out of that facility back to home and back to typical day-to-day, that's what that transitional care piece means. We want to make sure that the person or member and their family have everything that they need. We want to make sure that, if you have questions about, there's housing questions, there's, whatever the questions may be, to just make sure you have everything that you need. If you need a list to local food pantries in your region, things like that, the care coordinator can help with all of that. Community and social support services. We want our person to have everything they can to learn to be independent and to have all the skills and tools to lead as fulfilling and complete and happy a life as possible, being an active part of the community, and social services and social supports are so important for our loved ones. And then that health information technology piece, a care coordinator may be alerted that maybe you brought your loved one to an emergency department multiple times over the last few months. Is there something that we need to discuss? Is your primary physician not working out, that maybe we need to look for a different one? So there's a lot of reasons why we want to keep our finger on the pulse for the health information technology. So what's a life plan? I've mentioned it a couple of times. A life plan, I've always looked at a life plan as a mom as like an IEP, but for everything outside of school. So there's that assessment narrative summary. So what happens is when you first enroll in care coordination and when your care coordinator first comes out to meet with you, your child, and the family, they're going to start what's called a PATHS assessment. And the life plan development is driven by the person, so by the member, with input and participation of all members of the care planning team. Through the person-centered planning process, care coordinators can assist our members in accessing services that can support healthy, well-rounded, and fulfilling lives. And you'll notice I keep mentioning fulfilling. We want our loved ones fulfilled, and having a complete and fulfilling life. So the care coordinators will work with the member and their family to bring together healthcare, the developmental disability service providers, and develop an integrated life plan utilizing that person-centered planning process for each person, including all the areas you see here. So, there's that assessment narrative summary, in the beginning, it's all about me, all about the member. Then there's the outcomes and support strategies, or the goals. So we want there to be goals that are attainable for our loved ones. The IPOP section, or the individual safeguards, individual plan of protection. That could be, what keeps people safe. How, like if you're out in public, if you're at, say, the local fair, how close does your child have to be to you? Do they need to be in range of sight? Do they need to be touching you? All of that information is going to go in there. All the home and community-based service waiver programs and Medicaid state plan authorized services, there's a section for that. And they call it an HCBS waiver. And later, Amy will be talking about that. But I wanted to just tell you what it is. It stands for the Home and Community-Based Services Waiver. This is where all OPWDD funded services would be. All support, then there's a section for all supports and services, both funded and natural and community resources. So this is where the list of all the providers that support your child would be listed. So the school information, the doctor, the dentist, behavior support, etc. And this document, just like an IEP, can change as the needs of the person changes. Just like with an IEP, it's a living, breathing legal document that can change as the needs change. Typically, a life plan is assessed and reviewed every 6 months, unless there's need to revisit it sooner. So just so you're aware for that. So care coordination and school collaboration. So we can work with the school. The care coordinators can work with the school. They can help you in navigating the school system. We want care coordinators invited to the CSE meetings. So to your IEP meetings, they can help link to community educational supports. If there's a need for educational advocacy, they might be able to provide some guidance or link you to outside educational advocates that, could be able to support you in school if it came to that. They can help to communicate and share updates with the school support team. They can collaborate in that transition planning. And we at Person-Centered Services looks at our transition planning. And in the disability world, it starts really at age 14. We as parents need to be thinking about what's going to happen when the school bus stops coming, right? Because that's going to happen. It's inevitable. We helped to create with the care coordination team a transition checklist. So what to start thinking of starting at age 14. And that is something that there'll be a lot of handouts that you'll receive in a follow-up email, and the transition checklist will be one of them. And then the care coordination information can be added to the PLEP statements, or the academic present levels of performance section, in the transition section of the IEP. So all that information can be in there, and we want them to just be an extra support for you with your school meetings as well. Now, what are your responsibilities in all of this, right? What's your role? You drive the bus, right? When your child's younger, you're going to be the driver of the bus with your child in the passenger seat. You're going to help to identify, any issues or problems. What's the best mode of communication? Is it email? Is it phone? Is it text? You're going to communicate your needs, your wants, and any changes that need to happen. And as I'm saying, this should absolutely be your child. If they are able to be an active part of this, we want them involved in all these conversations. And when they become young adults, they should be the drivers of the bus, to whatever extent that they are able to. We need to make sure that you're following through with any action items that are left or emailed to you from the care coordinator, or that you decide on a phone call with the care coordinator or at the life plan meeting. But most importantly, we want you to understand that this is a team effort. We're all pieces of the same puzzle. So everybody that's part of your team, we all are in it for your child or your loved one. So, the interdisciplinary team, I've mentioned, the team a couple of times. So, this kind of tells you who can be the IDT or interdisciplinary team members. So the natural supports, so that's you, those are the family members. That can also be community members. Maybe your church family is an added support for your loved one. The care coordinator is a piece of this team. Clinical support. We have a pretty robust clinical department with registered nurses and behavioral health specialists on staff to help with any clinical needs that there may be. The program providers, so whatever programs your child is enrolled in or gets enrolled in, the program providers are part of that IDT team. Those social supports and social programs that your child may be involved in or that you're interested in, that's all part of the team and part of, they're a member as well. And then who else? It can really be anybody that is an active part of your child's life or a support that is a part of your child's life. So now Amy's going to pick up and start with the intake and enrollment. And remember, I know somebody hopped on after I started. So just real quick, there is a chat box and a Q&A box. And if you have any questions as we're going through this, please type it in the chat or QA box and I'll be monitoring that. Thanks. Okay, Amy.
Thank you, Christy. So like Christy mentioned, our next section will be about intake and enrollment and OPWDD eligibility. So who is eligible for OPWDD, also known as Office for People with Developmental Disabilities, and how do you get enrolled in care coordination? So there are two different versions of eligibility. So the first one is provisional eligibility, which is birth to 8 years old. This is temporary eligibility status for children under the age of 8 who show potential for a developmental disability, but may have delays that could improve with services. Provisional eligibility allows the child to receive OPWDD supports and services while OPWDD assesses the child's long-term eligibility, which occurs before the child turns 8. So between 7 and 7.5, if your child is enrolled in care coordination and has provisional eligibility, you and your care coordinator will receive a letter for redetermination, and your care coordinator will support you with gathering updated assessments and supporting you through that process. And OPWDD will look at delays in functioning related to cognitive, adaptive, social, emotional, motor, and or language areas. So I always recommend that as the child's aging out of early intervention around the age of 3, that is a great time to connect with our intake department, which is a free service to support families through the entire eligibility process and Medicaid if needed. And then we will support with all of those needs, which I'll get into what that looks like. But we aren't able to support children while enrolled in early intervention unless the child's at a program called Daystar. That's like in Rochester, and that's one program where we can support the child before exiting early intervention. But that's why we recommend connecting with us as exiting early intervention. So then 8 on, that's more permanent long-term eligibility. So how do you qualify for that? So this is for individuals with an intellectual and or developmental disability with proof that it happened prior to age 22 If a person receives an autism diagnosis after the age of 22, that is the one diagnosis that OPWDD typically will still accept. It just depends on the documentation and the assessments that occurred. And then with having the qualifying diagnosis, the person also has to meet substantial handicap, which is determined through an adaptive assessment. So the adaptive assessments are crucial and they will make or break eligibility. So I am going to read this word for word because it is very impactful and really helps give that perspective for parents when they get a chance to answer an adaptive. And this is also a good perspective for any assessment that you're completing for your child, including an adaptive assessment and others. So this is designed to measure a person's level of independence at normal daily activities such as dressing, eating, and communication with others. This assessment should reflect not what the individual can do, but what they actually do on their own, with no prompting, reminders, adaptations, or structuring of the situation. So I always tell families, like, think of your child on their most challenging day. Can they do the task with one verbal prompt? So that really, kind of gets the wheels spinning. And most times the parents will say no, and that's okay, because it doesn't mean they can't physically do it. It just, we want to know what they can do without that prompt and supports and help. So if the person needs reminders, maybe they need picture charts, supervision, items placed in a certain location, maybe things being laid out ahead of time for them, or things placed in special containers, or just some examples, then we would not want them to be labeled as independent for this assessment. Again, it doesn't mean that they aren't independent, but this will help them get your child access to services and supports to help them grow their independence and live that fulfilling life. So once connected with our intake department, which we a little bit later in the presentation will go through how to connect, the intake specialist will work with you and the providers in your child's care team to gather all of the necessary documents. The intake specialist is not able to submit for eligibility review until they have all the documents. So there might be a little bit delay while they're waiting for records to be received. And then the intake specialist will assist the family with completing the social evaluation. And then if the person does not have Medicaid, they will also complete an in-process life plan, which is, I'm jumping ahead, so I apologize. So for those families who do not have Medicaid, you do need Medicaid in order to enroll on top of the eligibility. So if the person is under the age of 18 and does not have Medicaid, the following additional steps will be needed after eligibility is obtained. So the intake specialist will assist you with helping you complete a DDP2, which is known as a developmental disabilities profile, and that you will actually be assigned a front door facilitator through OPWDD to coordinate with your intake specialist through this process. So the front door facilitator is the one who will be administering the DDP2. You want to keep in mind the same perspective that we reviewed for the adaptive assessment when answering the DDP2. And then you'll also need to complete a child and adolescent needs and strengths called a CANS assessment, which is for children 17 and under. And this is administered by a third party. So it will kind of seem like a little overwhelming when all of these other people get involved, but that's where you have your intake specialist to kind of guide you and support you. And then the intake specialist will create an in-process life plan where that social evaluation is completed. And then they will assist you with applying for an OPWDD waiver service. If that is approved, then you'll apply for Medicaid, where your income is not considered. They just look at the child's assets themselves, not the parents, and then could potentially deem your child eligible for Medicaid based on disability. So the process for getting approved for waiver, so it goes eligibility, waiver approval, Medicaid enrollment for your non-Medicaid families. If you already have Medicaid, you would go eligibility and then move on to enrollment. So to meet the requirement of a reasonable indication of need for services, all other avenues must be explored and documented in the in-process life plan. So the avenues that should be explored before requesting a waiver service are something called family support services. These are grant funded services through OPWDD where you only need eligibility. You do not need Medicaid or enrollment. They're meant to be bridge services that you can begin accessing services to help meet your needs prior to the Medicaid and enrollment. And these do need to be explored first before your intake can explore applying for waiver, because they need to show what you've attempted to access. So we do, in the follow-up email, send you a link to our community resource documents webpage, where you will have access to the Finger Lakes and the Western New York Family Support Services Directory, and a list of allowables for family reimbursement, which is a subcategory of support services, where you can get up to $3,000 of things potentially reimbursed. You'll also have to exhaust community supports, natural supports, and school supports. So this slide might seem a little overwhelming, but again, remember, you have your intake specialist to handhold you and explain and navigate you through the whole process. On that resource documents webpage, there's also a facts and question and answer document, and there is a flow chart with additional information. So we created supplemental resources to help explain this further. So the other part of this is that the need for something called environmental modifications, vehicle modifications, assistive technology, and family education and training. These are called waiver services, but either alone or in combination with one another, unfortunately, does not sufficiently demonstrate the reasonable indication of need, because the service that you're applying for to get the waiver and the Medicaid has to be an ongoing service need. So those two options are respite, which is caregiver relief, and or community rehabilitation, which is a life skills assistance. So respite, you're typically going to apply for as your main service from like 3 to 11 years old. 11 and up, you would apply for community rehabilitation. Again, your intake specialist navigates all of that and supports you with the application. If for some reason the waiver application is denied, which would not allow the next step of Medicaid enrollment, and let's say your case gets closed out, you always have an option to appeal it and work through that, or you can continue accessing family support services as long as there's eligibility. So there are still benefits of just having only eligibility. And Christy and I are your connection. So if you process this and have additional questions, we will always be here to support you and answer any of those questions. So please reach out via email or phone calls if you have questions you want to talk through. And these services, as well as other time-limited services, are not intended to be provided on a long-term and regular recurring basis, which is why you need that respite and or community rehabilitation approved. But you can get, if you get one of those approved, you can then also apply for one of the short-term services above. And these are designed to enhance, complement, or offset other regularly recurring service needs. So if the person is deemed eligible for a waiver service, then you will be granted a waiver parental deeming, where the parental income and resources are not counted in order to access the waiver. So in some cases, a child under the age of 18 may not qualify for Medicaid based on their family's income. So in these cases, if OPWDD determines a child is waiver eligible, then that parental deeming may be requested, which allows a child to meet Medicaid financial eligibility to access services. So it goes eligibility, waiver approval, Medicaid with your parental deeming, and then you move on to enrollment. So again, we have resources on our website that help explain all this further. And then those OPWDD supports and services a little more in detail. So if you have eligibility and you've got the Medicaid and you enroll, then these are some waiver services your care coordinator might help you try to access. And just remember that care coordination is so much more than OPWDD waiver services. So whatever need might arise for your child, which we know might change throughout their life, it is up to the care coordinator to determine the community supports and services that might help meet that need. So it might be referring to a new doctor, a new dentist, behavioral health specialist. Maybe you need help with transportation, maintaining your benefits. So it might be that they refer you to an OPWDD waiver service to meet that need, but they also can refer you to community providers to help as well. So self-direction is a unique way to access the service system and more. So you'd be able to actually hire your own respite or community rehabilitation worker. I do this as a second job. There's tons of professionals who do this as well. There's also agency-supported community rehabilitation. Again, that's typically 12 and up. And just going back to the self-direction, you can also get reimbursement or coverage for community classes. So like maybe at Autism Up, or maybe there's a cooking class or a martial arts class in the community. And that community rehabilitation worker could maybe support your child at that program. You could also maybe get memberships that are open to the public, like the YMCA, the zoo, the museum, etc. And then moving on to the respite, there's in-home, site-based, and recreation. And then those other short-term services that we mentioned on the waiver slide. And then once your child exits school, a whole array of adult services open up. So there's different things like day hab, which is day habilitation, where there's transportation. It's Monday through Friday. It is more structured. Maybe you really need to work on those life skills and start volunteering to work your way up to getting employment support. There's also residential support potentially, but this is what the care coordinator is there for, is to support that transition to adult services and help that transition be smooth and have services in place once the school bus stops coming. And there is a small bucket of OPWDD behavioral and mental health services. And again, if these don't meet your child's need, then they can refer to community providers for these behavioral and mental health needs. So there's CSIDD, New York START. So there are, again, those crisis services for ages 6 and up. There's intensive behavioral supports. In-home behavior supports are actually typically family support services, which again, only you need eligibility to access, not Medicaid or enrollment. And then in Monroe County, there's a program that partners with Strong Hospital called CHIRP. And then there's some mental health supports like Article 16 clinics and Presence Developmental Services. Both have an array of therapies. So how does one connect with our intake team? So we have a couple different streamlined options. So there is a referral packet on our website that professionals are able to support families with. So I would contact your school team if you're looking for support with this packet. So everybody who connects with our intake team, no matter which route you go to connect with us, has to complete a referral packet. So we have trained tons of school professionals to support families with this paperwork. You can call our direct toll-free line and a referral specialist will assist you. Or if you need additional support, you could reach out to Christy or I for help. And then I had mentioned the front door. So every person connecting with our intake team will also need to contact the OPWDD front door. If you happen to be on this call and you're in Cayuga County or a different county outside of Region 1, you can reach out and we can provide you that number. And then we also recommend step 2 and 3, watching the front door videos and our person-centered services intake video. They're great resources. They're not mandatory, but very valuable resources we highly recommend watching. And when you do call the front door, you might have to leave a voicemail and get a return call back. They're going to ask you for general demographic information to open your child's case and assign you a front door facilitator and assign a TABS ID to your child, which is the number we use when applying for eligibility review. And just let them know that you've connected with person-centered services. So what can you expect? Once you have connected with our intake team and completed that packet in whatever route you choose to go, then you will get that intake specialist assigned to you. And that intake specialist will work with you and the care team to obtain all records needed and then submit to eligibility review on your behalf. And then once that review is complete, you'll either receive an eligible, denied, or a request for additional information letter. And those will all be explained to you by your intake specialist. So they're going to continue explaining what those letters mean in your next steps. And then if you are deemed eligible, then they can help you with the Medicaid application and waiver process if you need Medicaid. Once you have eligibility in Medicaid, you move on to enrollment. So some general resources that we like to share, which we will again share these in the follow-up email, is we have an events calendar on our website that is just a great resource to show you where community events are happening or other webinars we might be hosting. There's 2 different OPWDD Facebook groups that I highly recommend professionals and families connect with. So there's one about Region 1 and there's one about self-direction. So we do share a document with links to those. And then there's that family support services directory, which will be on our website, and we'll share that link. In the driver's seat is a informational website about self-direction if you're interested in learning more about that. Parent to Parent of New York State and Parent Network of Western New York are great free resources, and they offer tons of support and webinars. And again, we will share a link with you to all of these different great resources. Oh, not sure why it went to a second page. I apologize. We also have a YouTube channel. And here is the QR code to take you right to our YouTube channel. So every webinar that we do, we record and put on our YouTube channel and our website. I highly recommend subscribing because you'll get notified every time a new webinar is released. And here's our QR code to that resource document webpage that I've mentioned a couple times. We'll also send you the link to it and the PowerPoint. And then our next upcoming virtual events, we have our last engagement series session in November 18th at 6 p.m. on Microsoft Teams, and that is bullying and youth with special needs. And Christy will be our presenter on that. And then in January, we have our Transition Services Virtual Expo. It's an opportunity for parents and caregivers of students ages 14 to 22 who receive special education services to hop on Zoom and connect with local providers who have transition programming. I'm not sure why we don't have our Access VR one in here. That was an error on our part. We will send you that flyer, but we also have an Access VR webinar that unfortunately can't be recorded. So we highly recommend attending that. If you're interested in the expo, it's a good thing to attend prior. And we will get that flyer out to you. And so how do you connect with Christy and I to ask questions and learn more? Here's our contact information. So our phone numbers, our emails, and the counties that we support. And again, you will get a copy of this PowerPoint that has all of this information in it. And then just quickly, if you have a few minutes and you have your phone on you, if you are open to sharing some feedback, it's very valuable. Please scan the code and complete the quick 10-question survey. And we do really value that, like I mentioned, and it helps us improve our presentations and different content to potentially add and questions to answer. So we will get back to you if you have any feedback that needs to be reached out about, but please take a few minutes and fill that out. And then you can also find us on an array of different social media platforms. So all these QR codes will take you right there.
And Amy, I'm going to pop on real quick. So we did have a question, and I'm not sure if you answered it when you got to when you were going over the Medicaid, but somebody had a question about my son has autism. He has OPWDD, but not Medicaid. So he is not enrolled in care coordination. He's 10. And she said, how important is it for me to do the work to get him approved for Medicaid? If that's even possible at this point, what benefit will that give him?
So the benefit.
Oh, go ahead, Amy. No, go ahead.
Yeah, sorry. So the benefit that having the Medicaid will help you to be able to enroll to receive care coordination and access to all those great services and supports that we talked about. But you would have to you'd have to be connected with our intake department to assist you with applying for waiver, where you'd have to exhaust all those options first. So definitely feel free, depending on the county you live in, if you want to connect with Christy or I, we can talk through your scenario and situation a little bit more, and we can provide you guidance on whether maybe holding off until closer to 12, where you can then apply for community habilitation as your waiver service might be a recommendation, and continuing accessing family support services in the meantime, or we might, based on your case, recommend that you do connect and try waiver. So it will be a case by case, but I would definitely reach out to Christy or I would email us your availability and we can schedule a phone call.
Yeah. And I hope you are accessing family support services, or trying to, because we know there's wait lists for, a lot of the different programs that are on there. But, that's definitely something that you have access to with the OPWDD eligibility prior to having Medicaid. So that will be, when I send you the follow-up email, you'll have the link to our community resource page that has both the West and the Finger Lakes Family Support Service Guide. So again, depending which county you're in, which region you're in, will tell you what programs there are in your area. So I'm not seeing any other questions. So if nobody has any, you're welcome. If nobody has any other questions, thank you so much for joining us tonight. We really appreciate you carving out a little bit of time to learn a little bit more. Don't hesitate to reach out to Amy or I if you have, specific questions about your child or about your situation, or, Lisa, if you want to learn more about the Medicaid piece and talk about it a little bit deeper, Amy or I are both really happy to schedule a time where we're able to, give you undivided attention to kind of go through your scenario with you. And be on the lookout for that follow-up email. If I don't get it out tonight, I will definitely get it out first thing in the morning tomorrow.